Autoimmune diseases come in many forms, but some are especially complex and life-changing. Today, I am going to talk about 3 that I consider most severe: vasculitis, lupus, and dermatomyositis. If you have been recently diagnosed with any of these diseases, you're probably wondering, what do these conditions mean for my future? So stay with me, because what you will learn here could change the way that you manage your health. Let's start with vasculitis. When we think of autoimmune diseases, we often think of joint pain and skin rashes. But vasculitis is different. It attacks your blood vessels, and in some cases, the results can be devastating. So why does this happen? Why do your blood vessels become the target? In vasculitis, your immune system mistakenly sees the blood vessels as the enemy. This leads to inflammation, causing the vessels to narrow or even rupture, cutting off the blood flow to vital organs like your heart, lungs, or kidneys. These symptoms can be very subtle at first. Patients can present with fatigue, fever, losing weight, sinus issues that never end, eye inflammation, hearing loss, and then more and more issues will surface. Some patients can develop severe lung problems that looks like pneumonia, but is so much more than that. Some patients can develop heart issues like fluid around the heart or even heart attacks, while other patients may develop severe kidney failure and even nerve issues like a foot drop or a wrist drop. And these symptoms can be very challenging, and having a doctor that has experience to diagnose and treat vasculitis becomes crucial. Now let's talk about lupus. You might have heard that lupus is called the big impostor. But what makes lupus so serious? Have you ever wondered why lupus affects so many parts of the body? Your skin, your joints, your heart, your kidneys, and sometimes all at once. Lupus is also an autoimmune disease that can cause inflammation everywhere, from the smallest blood vessels to the major organs like your kidneys. And that can cause what we call lupus nephritis. But it can also affect the lungs or the heart or even the brain. Most of the time, lupus is unpredictable. One day you are dealing with a rash, or the classic butterfly rash, or hair loss, or joint pain, and the next you could be facing something like kidney failure or a heart problem. But the real danger with lupus lies in how hard it can be to be diagnosed early. In my practice, I have diagnosed a very severe case of lupus that affected the brain of a young man. Fortunately, the patient got the diagnosis and the treatment in time, and he recovered completely. But his case remains a testimony of how important it is to get the right diagnosis and the right treatment in the time to save your life. I even published this case in a very respected rheumatology journal, so if you want to hear his story, I will put the link of this article in the description of the video. And now let's talk about dermatomyositis. This disease might be less familiar, but it's also very severe. It's often thought to be a skin disease because of the characteristic rash, but the truth is dermatomyositis is just so much more than a skin rash. What if I told you that this disease affects also your muscles, making it difficult for you to walk, to get out of the chair, or getting out of a car, or climbing stairs, or even to lift your arms up? And it's not just about muscle weakness. It can also affect your lungs, and in some people can lead to dangerous breathing problems. Why do you think this happens? Why do you think the muscles and the lungs are the target in dermatomyositis? The inflammation caused by your immune system will weaken your muscles and will cause scarring in the lungs, which can lead to interstitial lung disease. When lungs are affected, this can make simple tasks like climbing stairs or walking feel very difficult. I actually have another video about dermatomyositis and the most common signs and symptoms right here in my channel, so please check it out. So why do rheumatologists take these three conditions, vasculitis, lupus, and dermatomyositis, so seriously? Because, as you can see in this video, these diseases can affect any part of your body at any time. And because they are unpredictable, they are often silent in the beginning, and if you left them untreated, the damage can become irreversible. But there is good news, because managing these conditions very early can help you prevent these long-term consequences. There is so much more than I can tell you, but it's very important to work with a rheumatologist to catch these diseases early and to protect your organs before they are damaged. So if you want to learn more about how to stay ahead of your autoimmune disease, make sure you watch this next video.
Rheumatologistoncall.com